Today I wanted to talk about vitamin D3 replacement that we do for our patients. As most of you know who are practice patients, we're very aggressive with vitamin D3 replacement. We try to get all our patients, the normal levels are 30 to 100. Over the world, the normal levels in most other countries are from 50 to 150, but United States and North America, Canada also, and Inter-America has kept the levels of 30 to 100, which are the levels that we use. So we want our patients to be above 80, between 80 and 100, because neat things happen when you do that, amazing things. First of all, the risk ratio for skin cancer goes just way, way down. And I'll tell you a short little vignette. In this room, by the way, this is 4 years ago, I went to the conference on D3 replacement, some of the newest ideas about D3 replacement. And it came out, this study is showing that the skin cancer rate, when your vitamin D3 levels are above 80, just plummets to zip. And I had a patient, a new patient I saw the first time. He was 42. He had a gene defect in his family. All the males got skin cancers, all right? He was 42, he'd already had 100 biopsies off his body. And he came in to see me, and he's covered with what we call pre-actinic skin keratosis, precancerous lesions, hundreds, thousands, you can't count them. And all we do with these patients, we bring them every 6 months, we strip them naked, we take the biggest ones off, all right? He's had, age 42, over 100 surgeries. Anyhow, I told this patient about this, this idea, and did what we usually do, which we're going to go into. And I'll never forget, 6 weeks later, I walked into this room, and this patient's sitting right here, standing, butt naked, no clothes on him, arms up like this, smile from here to here. I walked in and said, what did I do wrong, kind of thing, The bottom line, this patient had 80% of his skin cancers and pre-skin cancer lesions were gone. It was one of those, oh my gosh. In fact, if I hadn't been smart, I would have taken a picture before and after and written a case report about it. Anyhow, this guy was just ecstatic, all right? And once you've seen that, you start to realize the power of this. Now, there's a bunch of other things that have come out that sort of reinforce why we're so aggressive with D3. For instance, this last year from the flu, on this last year's flu cycle, if your D3 level is above 80, it was more effective than taking the flu vaccine in preventing the flu, all right? Number two is for males. This is amazing. This came out a couple of years ago, was published, but if males keep your D3 levels above 80 and take a little bit of iodide, the risk of prostate cancer goes to zip. It's just amazing. But there's a whole bunch of neat things. As you know, the Mensink motto for the practice, I like things that are very reasonable, cost-effective, very little downside and tremendous upside. And D3 replacement is one of those. But let's talk about some of the issues so you understand the important things. When you come in, if your levels are low, we will start you on a high-dose D3 replacement, all right? It is a very high dose. It is safe to take, but there's several things you have to do. You have to take a high-dose vitamin K2 that is very absorbable. And that's why we make you spend a lot of money to buy our special multivitamin that has that in it, so that you will not get in trouble with any complications from doing this high dose. That's the first thing. So it's important that you have to take that a minimum of 2 months, all right, twice a day, the multivitamin, because it has high dose vitamin K2. The vitamin K2 is the expensive part of nutraceuticals. We can give you vitamin D3 with vitamin K2 in it, but for an extra $10 a month you get this phenomenal multivitamin. Just for most people, we give them the multivitamin because it's a much better price and gives you a whole bunch of other things needed. The second thing is that you take the prescription multivitamin for the vitamin D3, and what we do with that is then for the first month you take that every day with the multivitamin twice a day. And the multivitamins prevent you from getting any complications from this high-dose D3. At the end of that month, you have to start taking the vitamin D3. Usually we sell here a 10,000 unit capsule. It's usually cheaper than buying it at Costco. It's a very well-absorbed form. The third thing we do for all our patients, we want you to take 2 fish oil capsules. And there's a reason, and we tell patients you can buy the cheapest one out there. Go to the dollar store for all I care. It really doesn't matter, whatever's cheapest. And the reason is, all you need is you need to make sure that you have enough essential fatty acids so that you will absorb the vitamin D3, all right? Because rarely, if you don't have enough essential fatty acids, you won't absorb it. So that's the reason we do that. And that can be the cheapest around there. You buy it wherever you can, wherever it's most reasonable. The last thing is that we ask our patients to come in 6 months later to repeat their level, to see, it takes about 6 months to equilibrate, to see where they're at, about 80,000, a level between 80 and 100, because neat things happen. And it's part of anti-aging medicine to be aggressive in those areas. It's part of a life extension practice, and amazing things happen. But just want to say those, a rough idea of how we do it, because we tell most patients it, but many patients it doesn't sink in. All right, and we get a lot of questions, so maybe this will help resolve some of those questions. Thanks for being part of the practice.